investor, for having Andrew and myself here. It's a shame Chris isn't here because he's, what's the right way of putting it? He's a combative character, and we would have had, I'm sure, a few sort of, and Andrew and I seem to be very sort of mellow types, so it's going to be a very, hopefully don't agree too much.
Well, I bring the Welshness, so that's one thing that I can stand in for Chris.
And I bring the Scottish taciturnity, if that's the right way of putting it. But I, in particular, wrote a book in 2012 called Cracking the Code, which was a description of biotech as it then was, and in just 5 years, almost everything has changed because of the pace of technological advance. The most important element of which is the invention, as you know, of CRISPR, which is going to alter very many things in the medical world in the next couple of decades. But my sister, who's here, over there, has been, and my colleague Anthony Chow, who's somewhere else, there, right in the front row, have been assisting me very greatly with a new book, and today we've been working on it, and the new book is called Juvenescence, and it's about longevity, and for the last year I've been researching with my co-writer Al Chalabi the fact that, and it's a fact, that the average life expectancy of the developed world will rise to about 110 within the next 20 and 30 years, and that's going to change everything. So one of the things I want to talk about today is how does that impact society? How does it impact us as investors? How does it impact us as family members? In fact, how does it impact the world as we know it? And the answer is quite a lot. And so I'm going to be mostly focusing on that. So over to you, Andy.
Okay, well, thanks. So I'm Andrew Parry, and thanks Neil and Edison and Master Investor for inviting me along. I have a family member here, tucked away in the corner there, Charlie, my daughter, who was, I think, responsible for getting me invited to talk to you today. So we've all brought our families along. As you can see, I'm the one wearing the tie, so I come from a much more mainstream environment. So I run listed equities and impact investing at Hermes Investment Management. So I'm the boring one of the two. So we're going to do a real yin and yang today. I guess my perspective on technology and healthcare comes from a more sort of generalist perspective. The view from the wide range of opportunities that are out there. And for me, this is one of the most dynamic periods in my investing career. I've been at this for 34 years, and I think in that period we've seen a lot of change, a lot of fads and fashions, but never before have we seen so much creative destruction going on. Never before has technology had the ability to change our lives in every aspect, longevity being one, but the way we live our lives, the way we work, whether we will work. There are four, as I see it, four major transitions going on at the moment, all of which overlap and collide and are particularly visited in the healthcare sector. So the first one is geopolitics. I'm not going to bore you all with politics. I think in this country we're thoroughly sick of politics, but it is a major influence on all our lives and behaviors. The next is technology. I think we're in the fourth wave of an industrial revolution. The third is in demographics, which is Jim's point about longevity, and I think that is in a major significant change. And then technology. Technology is an enabler and a changer of our lives. And in healthcare, all of those come together to actually have some profound implications in terms of growth opportunities, but also they are going to raise some, and we'll probably get onto this, I'm fascinated to hear what Jim says about it, about some really ethical issues. And I think this is one thing that we don't think enough about when we're looking at technology, we're looking at healthcare and all the changes that are going along. And maybe that's why geopolitics is such an important issue, is that it raises some very big ethical issues about costs and who gets treatment and access. So I think there's quite a lot of really fascinating stories to be told tonight.
And you started touching on, I guess, the place I wanted to start with, which is perhaps a little bit high level, just to get people understanding, how you think. You're particularly well known, Jim, in terms of being able to spot investable themes early, uranium, property. And I wanted to ask both of you, for this audience, what are the typical signposts that you look for, not just in terms of what makes something interesting, but what makes something investable as well?
Well, healthcare is the biggest industry in the world, and to put it in perspective, almost $1 in $5 spent in the United States is spent on healthcare. It's not very well spent because Americans live on average 1.5 years less than we do in this country, as an example, and considerably less than the Japanese or the Koreans do. But nonetheless, they spend a very large amount on healthcare. There's too much intervention in the United States. There's too much drugging going on in the United States. And you probably read that 59,000 people in the United States, mostly lower middle class males, died of prescription opioid abuse last year, which is these pills that you get if you have a bad back or whatever, and they become hooked on those. And that is the highest. That's the largest killer of men in that particular age category of anything, including accidents, gunshot wounds, suicides, and so forth. So there's a real problem in the United States. But nonetheless, it does represent a huge business. And it's the same in this country, where approximately 1 in 10 of our pounds is spent on healthcare, and that figure is going to rise. And of course, with the demographic changes and the fact that fertility rates are so low in the developed world, we're going to see an ever increasing number of older people as a percentage of the population. So the super aging societies at the moment, which are Germany, Japan and Italy, are going to be joined by another 20 nations in just the next 10 years. And that will include the UK and the United States, where more than 1/5 of the population is over 65 years old. So what the challenge for healthcare now is to keep those people in what I call a welderly state as opposed to an elderly state, because otherwise the burden of cost of maintaining all these old people, given the burden of the diseases of aging, will just be too much for society to bear. And so a lot of what I'm studying at the moment is how we can treat aging as a unified disease rather than as a syndrome which is characterized by a whole series of diseases of aging. And if we manage to treat aging, the root causes of aging, as a disease, then we can lessen the overall cost burden, which is going to be unbelievable for all of us if we don't find some solution. Because otherwise neurodegeneration, obesity, diabetes, cardiovascular disease and cancer is going to really wipe out the savings of nations and create a huge generational burden for the young people in societies.
And let me just sort of pick up on that. So it's the cost-benefit trade-off effectively that's sort of leading you into this space, and then in terms of actually then turning that into an investable theme, how do you actually find the places to actually put your money?
As with anything, the longevity science, which is a relatively new science, it really only emerged at the end of the Second World War, and it's only in the last 10 or 20 years that it's now translating into compounds and other therapies that are actually going to have an effect on longevity. The companies that are innovative tend to be small and private, and that remains the case. But you are finding companies like AstraZeneca here in the United Kingdom, and of course Novartis out of Switzerland are very interested in the aging space. One of the problems, if I may very briefly allude to this, is that we do, as humans, live very long lives. So if I want to do a trial on everyone in this room to see if my compound is going to keep you alive for the next 30, 40, 50 years, we're waiting a very long time, and trials cost a lot of money. So they use animal models and organism models to try and accelerate the process of those trials. But increasingly companies are saying, okay, well, let's observe whether the diseases of aging can be cured by, for instance, something like metformin, which is a generic anti-diabetes drug that's now being trialed in aging. And if it works to cure the diseases of aging, maybe it will have some observational effect on aging itself. Then we can start a proper aging. So big companies are getting involved, but generally speaking, it's small private companies. But there's a lot of money coming into this space now. I'm talking about billions of dollars, particularly in the United States.
Andrew, perhaps from a sort of institutional investor, where you often look at frameworks for investing, etc. Perhaps the same question, which is, what is your investment framework? What is your philosophy?
I think if there was one word that summed up what I look at, and it's the word change. Change creates uncertainty. Uncertainty creates mispricing. And also it's then linked to the real arbitrage I find in my space is taking a longer term time horizon than most people in the market. Because we're going through so much disruptive change in so many different sectors, of which healthcare is one of the prime examples, that means there's a lot of significant mispricing opportunity. But mispricing also goes two ways. And so I think we always have to think not just about the great growth opportunities in oncology, in aging, that the technology has brought to us, but also begin to think about the sort of concept of something I call stranded assets, which we take from the fossil fuels. There will be a lot of companies that get left behind by this rising technology tide. And I think as an institutional investor, we also have to think about the losers as well as the winners in this space. And I think for mainstream investors, that's actually quite hard because we get sucked to the biggest companies. And history tells you that the very biggest are often not the most innovative and not the most agile at adapting to these new areas. So maybe old-fashioned small molecule drugs from 30 years ago, there's going to be big challenges on pricing. We're already seeing that debate even in America. Everybody thought that the pricing debate would be gone when Hillary Clinton didn't win, but Trump is equally interested in pricing. And there's also another side to it as well, which we do need to think about. So if all the attention gets, say, focused on oncology and aging, these are all very high return, high value added opportunities. But we do need to think about the more mundane things, like vaccines. If we actually can cure many diseases in the emerging world before they become chronic and they need treatment as a disease, so we stop you having the disease. Or what are we doing about bacterial infections, antimicrobials? As bacterial resistance goes up and up as we take too many antibiotics, and not just directly when we all go to the doctors with a cold and insist we have an antibiotic, but actually through the food chain. Think how much, if you're a lover of sushi, I've gone off sushi once I realized quite how many antibiotics go into my sushi or into the meat industry that don't just then you ingest, but actually get into the food chain through the watercourses. So it might, in the end, if we don't think about those opportunities and don't find ways of actually getting money going into those, it might be all well and good that you can treat cancer at a much more higher rate of efficacy than you've ever done before. But if you get a scrape on your knee and no antibiotic will cure the infection, then we're going to lose it on the back end. And we do have some significant challenges there because those are the drugs at the moment that aren't actually cost effective for the big pharma to invest in.
If I could touch on some of the themes that you've both put up. I mean, when I looked at the sort of numbers of global spend on healthcare and the huge numbers, but also growing quite rapidly, driving that is demographics, and you touched on, I think, a lot of understanding of aging population. I was interested in your views of the emerging markets, and in particular the sort of the growth, a lot of the sort of increases in world population actually coming through from that, with an emerging middle class who can afford better healthcare, etc. Also wanted to just get an understanding of the improvements in technology. So we have started seeing FDA approving more and more drugs, and a lot of that is pinned down to mapping the human genome, better technology, and so on. So if you could touch on two or three of what is driving that sort of number from 6 trillion to 10 trillion, to give us an understanding of what are the big drivers of healthcare.
Well, by far the biggest market remains, despite the growth in emerging markets, the United States. And of that, I think you mentioned 10 trillion, 3 trillion at least, possibly just under 4 trillion is spent in the United States. And of that 4 trillion, about 10% is spent on drugs. Most of that expenditure is on generic drugs. So the innovative drugs do not absorb a very large part of the budget, but are very, very important to the long-term objective, which is to replace hospitalization with drug therapies and other forms of therapy, because the most expensive hotel stay that we're ever going to have is in a hospital. And in the United States, you can easily spend $100,000 a day, or your insurer can spend $100,000 a day, which effectively means all of us, if we were US citizens, would be spending that sort of money just being in hospital. So if the drugs can displace people from hospital, it's going to have a tremendous reducing effect on overall health costs. And that will apply around the world, which is why I'm particularly keen that new compounds that are efficacious are developed to keep people out of hospital, because it will genuinely reduce the burden of hospitalization. A second major component of healthcare is social care, domiciliary care at home. And as people get older, they require home care. At the moment, it's perfunctory. It's normally performed by people who are not valued in society, so they get the lowest possible wages. And sometimes, as you've read here in the UK, the visits can be as little as 10 minutes per day. There are companies out there that are disruptive. There's one in the United States called Honor, which I was very impressed by. It's a private company with a lot of Silicon Valley backing, which is trying to disrupt the social care industry, which seems to me such a good idea, using apps and using almost like an Uber for social care. And bringing into the equation genuine healthcare professionals who care about their patients and who don't spend all their time filling in forms or running from one location to the next. That's an industry that I really like. So if I was advising people to go into a career, I would not say go into being a lawyer or going into being an accountant, because many of the jobs, or banking, in that area are going to be computerized or automated by AI or whatever in the next 10, 20, 30 years. But human empathetic jobs are going to grow dramatically, and they'll be more highly valued in society. So I would say the social care industry is going to be one that we'll be definitely looking at as an investable area. So number one, drugs to displace hospitalization, which is a huge burden. And number two, look at social care as an investable area.
Andrew?
I sort of pick up on those themes as I think that, that prevention is a very important area. When you look at the developing world, I think Africa's forecast to grow its population by some 2 billion by 2050. If you're looking for the new China, it's many of the countries in Africa, so there's some huge growth there, massive urbanization, but very low life expectancy and very high disease rates. So which is why I'm very interested in vaccination and the opportunities that bring. But another area is food. When you begin to see Nestle and Danone and companies like that, beginning to see food as a way of maybe acting in prevention in many countries. If you go to Kuwait, 23.5% of the population have type 2 diabetes. So a lot of the diseases that we spend a lot of money on in society treating are actually avoidable. Some people reckon that diabetes could almost bankrupt the National Health Service, but type 2 diabetes is largely avoidable. So there are ways we can do this through food. I think one of the other things, and maybe it's going to be transformational over time, Jim mentioned apps. I think we are going to change the way we deliver healthcare. I think we're going to deliver a lot more in an almost Alexa, Siri-like way. AI is enabling a step change in diagnostics, and that we will be, instead of phoning 111, the National Health Service health check line, you will be actually talking to your phone. And I think within 5 years, the efficacy and success rate of diagnostics using things like this will be better than maybe going to see your GP. In fact, when I go to my GP, it often actually looks it up on Google, which I think I might as well have stayed at home and done that. But part of the reason why these are so complicated is not for you to do Facebook or play Angry Birds or whatever you'll do on there, is for actually enabling a step change in how we get health services. There's a very good, the machine for telling whether you have a heart attack, the standard one, is quite a clunky machine, it's quite old. But you can now actually have an app on your phone, and doctors do use it. One doctor saved somebody's life on an aeroplane because he had the prototype of the app on his phone to tell whether somebody was having a heart attack. Breath recognition, you can have a little sensor on the bottom of your phone, and it won't tell you that you had a curry last night or you're still over the limit, but breath recognition is increasingly being used in hospitals and will be a way of diagnosing significant health issues. So technology is actually going to have a potentially a big enabling benefit that will save costs in places like the NHS. They don't yet know quite how to do it, but your humble mobile phone, which remember didn't exist 10 years ago in this form, could very well in 10 years' time have a significant role to play.
And taking that, I mean, we always take a look at Big Pharma as a director of capital in the space. They invest very heavily. But the way you're describing this, actually, if it's the smaller companies, the more nimble companies that are going to be the beneficiaries. What is your view of Big Pharma and the role they play in this and some of the challenges that they might face?
Well, most Big Pharma companies are hidebound from a research and development point of view, and some of them have actually closed down research facilities because what they've become is marketing organizations and regulatory organizations, and as a result they have to buy their innovation. And so a lot of biotech companies are set up specifically to be acquired by Big Pharma, and I don't think that's going to change. But what's happening now is that Big Pharma is acquiring Big Pharma. And I happen to think that Gilead, if we're allowed to talk about individual stocks here, is one of the biggest companies in the space. It invented the cure, well, it didn't invent it, but it bought the cure for hepatitis C, which again, as recently as 2012, you could not cure hepatitis C. And if you look at people like David Bowie, who died of liver cancer, they died because of hepatitis C and early drug use. That's what they had. But it was too late by the time the cure came out for them. But today, if you are unfortunate enough to get hepatitis C, there is a cure, and it's made by Gilead. Gilead also owns, and I mean owns, the whole of the HIV market. And HIV patients today, and this is an increase of dramatic proportions in just 10 years, can live as long as the rest of us by taking one pill a day, whereas as recently as 10 years ago, they would have taken 10, 20 pills a day. Now, those sort of companies, which are cash-generating machines with a pipeline of innovation, are extremely attractive to Big Pharma, and they don't have the risk of you and I trying to identify what the next drug to succeed is in an early-stage pipeline biotech company. So for my money, I would be buying companies like Gilead, which are the next level of fish down from the great shark that are out there eating the companies, because they will be eaten in these massive, great big leveraged deals that are going to come down the pike.
And Andrew, same question for you. Anything else that you see?
I do worry about some of the very big pharma. It comes back to my ethical questions and issues before. I think there's big pharma, if it doesn't think about its behaviour, is in danger of having its own libel moment. The banks were acquiring banks before they actually, some of their behaviours would be seen as reprehensible. I think this is where populism and politics collide. When you think about drug pricing and double-digit price increases year in, year out in the United States, you think about some of the behaviours. Even one of my favourite stocks, Roche, because it is quite an innovator, is actually pulling out from the Access to Medicine Declaration because of the nature of the type of drugs it's producing, which is why I think this is going to be one of the challenges, is actually how the big pharma address pricing. So I'm just, for me, it's not the big pharma that are of interest to me. I don't think enough of them are innovating. One of the things I look for in any company, especially in sectors where we're going through a rapid technology change, is how much of your growth is coming from new products. There are a few where Gilead is an exception, Roche has been an exception, but not many of them are actually getting their growth from new products unless they buy them in. So for me, they're in a position of not offering attractive long-term growth propositions, and in many cases could be vulnerable to scandals and regulatory opprobrium, which is never going to be very good for your ratings. So for me, it's further down the food chain, and in many ways the enablers in the healthcare industry that are more interesting than necessarily the very big incumbents.
And taking that backdrop, perhaps now we can sort of really start getting into, you know, pockets of interest. Clearly, longevity bit will be one which I'd like you to talk about. But if in this massive space of healthcare, you know, you are looking at places to invest, things which are interesting, either from a sort of treatment area, technology area. If you could start picking maybe one or two sort of case studies and run people through, you know, the drivers and what you find interesting about them, bring that side to life for us.
Sure, but before I do that, I'd like to just amplify a bit of what Andrew said, because I kind of agree with him, but it has to be seen in context, the fact that the big pharmas are out there acquiring innovation. The cost of bringing a new drug to market is estimated to be between 1.5 billion US dollars and 2.8 billion US dollars. And although you mentioned that the FDA has increased the pace of approvals, it was still only 46 new chemical entities last year, which is pretty pathetic, actually, given the amount of drugs that are screened every year. And I'm talking about millions and millions and millions of them. So the cost of bringing a new drug to development is such that it's almost impossible for a small biotech on its own, even with equity funding and so forth, to get that drug to the market. And as a result, they end up in partnership or being acquired by big companies that have the financial means to do it. But this takes me to the next point, which is that if I am successful and I develop a new drug and it gets to the market, typically I've only got 8 or 9 years of patent exploitation left on that drug. And I've also got hundreds of other compounds that have failed. So the idea that there's a price gouging going on is an attractive idea to idealists. And might say Corbyn, if he was involved in the drug industry, would definitely be looking at that. The problem is that without the supercharged returns on the few drugs that make it, there would be no innovation. Now, I do think US consumers bear the burden of that cost, and here we in the UK are very lucky that they actually pay much higher drug prices than we do in the United Kingdom. But it has to be seen in the context of the fact that returns on equity for big pharma have been falling and falling consistently for years. The cost of bringing a new drug is unbelievable. The period of exploitation is very short. And the number of failures is greater than, for instance, in mining. You know, almost everything fails. And even if you model it all. So what's the solution to that? Well, at the moment, the process of bringing a new drug to market involves 3 phase trials. Phase 1, which is for toxicity, 2, which is for efficacy, and 3 is in the wider general population. And phase 3 is the really expensive and difficult one. Phase 2 is like a valley of death, and phase 1 is mostly passed by drug companies in early stages. But they all involve extensive animal testing. Animal testing, generally in mice or rats, and that animal testing is extremely expensive. Now, if we could bring artificial intelligence, we could bring computer intelligence to accelerating the process of finding new chemical entities, then you could both cut the cost and cut the time of getting new drugs to market. And that's an area that we're super excited about. So you asked me about what areas I'm interested in, and I would say the application of artificial intelligence to the discovery and testing of drugs is going to be a remarkable area. So forget about artificial intelligence as it applies to Google or Alexa or Siri or whatever. The really exciting area is in the application of artificial intelligence in medical science. And that's something we are looking at very, very closely.
Are there pockets of areas that you'd find exciting within healthcare?
Yeah, so I think some of the areas that we've been most successful in have been those people who have enabled the pharmaceuticals to operate more efficiently. So producing the plant for biological drugs, because those, we forget that behind actually the great science in pharmaceuticals, you have to manage these drugs to a very, very high standard. And if you have a biological drug, the actual manufacturing process has to be as rigid and rigorous as the actual science. So, some of those areas have been very interesting. I'm still very interested in diagnostics, and not just, I don't mean just Apple and Samsung moving into it, but generally in the area of new companies finding ways to bring efficiency. And for me, it's always about looking for businesses that deliver efficiency, because when you have big pharma, returning fall on capital employed with lower discovery rates, it's actually operating efficiency that is something that actually is sometimes an easy win. So it's further down the food chain, and actually the example of the enablers in the industry that are always more interesting to me.
I mean, longevity was billed as the sort of part of this sort of conversation. What other ways would you think of playing that you'll theme longevity? If we're all going to live to 120 and we want to have a good life, what other ways would you think of actually playing that theme out?
If we think about our societal constructs at the moment, which is that you're born, you learn, you earn, you then burn out, you retire and expire, which I think is a pretty good way of putting it.
That's pessimistic.
That's the current view. And I think everyone is in that mode. Most people are in that mode. And when I say, watch out, life expectancy is going to 110 in the next 20 years, people think a crackpot, a madman, can't be true. But let's go back to 1900. And if I ask people in this room, what was life expectancy in 1900? I think very few would come up with the absolute accurate number, which is 47. Right? And here today, we're in the 80s. So if we've gone from 47 in 1900 to in 2017 in the 80s, why can it not be that we can go to 110 in the next 20 or 30 years, especially given the technology, which I won't go into the great detail of, that I've seen, particularly out of the United States and here in the United Kingdom? And the answer is we can get there. And 110 represents our roughly currently maximal lifespans. But with genetic engineering and with stem cell therapies and other technologies which I can't foresee, it's entirely possible that we can go through the current maximal lifespan at some stage beyond that 10 or 20 year period that I mentioned earlier on. And the oldest person ever to have lived, properly recorded, was Jeanne Calment, who died in 1997 in Arles in France at the age of 122. I think I may have mentioned this to some of you before. She attributed her very long life to avoiding men, which is totally understandable, and giving up smoking on our 117th birthday. All right. So,
never too late.
But there are some geroprotective factors in super ages that scientists are now trying to identify and to implant or to put into the rest of us who don't have those what they call gene variants or alleles. And this is such an exciting area. And there's other things which I could put you on a regime tomorrow, Neil, and almost guarantee that you'll live another 10 or 20 years. You just have to hand me half your income every month. So you can see why it's going to be such a big industry.
And Andrew, I mean, you talked about the sort of weaving of these themes into so many other sort of aspects of our lives, and other sectors, etc. When you're thinking about the drivers of healthcare, what else are what other sort of sectors do you think get sort of pulled into this space?
It's across the board. The whole way that we consume leisure is changing. I think that's is continuing to be an interesting housing. What sort of housing we all need. We're all going to live to 120. We're not going to all be wanting to live in 6-bedroom houses. So the retirement village opportunity is is quite an interesting one, particularly on the sort of the private market side. Automation. I think automation is one of the most fascinating areas, because it's not just about quantity of jobs, it's quality of jobs, but technology is also bringing us challenges on that. So you think about all the reports on how awful it's to work in an Amazon warehouse. People having to take their bathroom breaks out of their 12-hour shifts, and people walking 20 miles a day, and it sounds horrendous.
Very good for you, though.
Not if you're 120, maybe. But they're pretty stressed jobs, and people who do it, and they're on 0-hour contracts, which is a pretty stressed way of living. But warehouse automation, we own a stock called Kion, which it's a German stock which automates warehouses. They just automated a warehouse, for example, in Singapore for LVMH, where their throughput went up tenfold. So the productivity in that, it gains on technology are huge. The amount of people they employed went down significantly, but it's a loss of low quality jobs. Now the bit that all the pessimists don't see is that technology is driving the long awaited productivity miracle. If you read a lot of economists, they lament the loss of productivity in the last 40 years. I suspect the next 40 years is going to be about a big increase in productivity. I think, other than a visionary like Jim, people when you get to my age, we're not the best people always to actually see where those new jobs are. It's very hard. I sometimes find advising my children about where they should go and get jobs. So I think we will be surprised by the amount of innovation and job creation that comes from areas that we don't yet see, which is why I think as a firm we try to encourage diversity in company boards. So not just crusty middle-aged men like me, but greater age range, gender range and ethnicity, because we see you need a different perspective to tackle a changing world. And in fact, if you look at those women-led entrepreneurial companies, they tend to outperform men, which is not a fact that not many people know. So I'm all for encouraging really innovative ways of thinking, and what I'm looking forward to is being surprised by actually how many industries rise from technological innovation. I'm not a pessimist that the technology necessary is going to lead to 2 billion unemployed people marching down the streets. I think it will lead to 2 billion people over time transitioning into jobs that we don't necessarily envisage today.
You talked about failure rates in this industry being very high, and I think that talking about the sort of risk side of investing in healthcare is something which I wanted to explore with you. So, what are the red flags that you tend to look for, or things? Is it just part of the sort of accepted norm that there is going to be failure? You need to build a portfolio which accommodates for that, or are there particular things that you look to avoid?
I think hype is a very big red flag. And if I may, I'll give you an example of that. There's one of the anti-aging companies that's raised a lot of money recently. It's called Unity Biosciences. And it's producing a drug, or it's trying to produce a drug, which is called a senolytic, which is to remove senescent cells from the body. Senescent cells are those that are in a limbo state between properly apoptosed or dead cells and healthy, working cells. And they secrete enzymes which are very inflammatory. So inflammation, such as metabolic disease and diabetes, is in large part caused by just a few senescent cells in the body. So if they're capable of removing senescent cells, then obviously that's going to be tremendous. But the guy who runs it has come out and says, we're going to fry a third of all human disease, and we're going to do this and that, and it strikes me as a hype situation. Now, there are other senolytic companies out there that are more sober-minded, have, in my opinion, equally good or even better technology, and I prefer that sort of approach than the we're going to cure everything type approach.
And from your side, Andrew, I mean, the risk clearly something that you look at when you're investing.
Yeah, funny. I was going to say self-promotion of the chief executive was going to be one of my big red flags. I think you have to accept that if you're going to be investing in innovative industries, you are going to lose money at times, and you're going to lose a lot. You probably lose every now and again a lot. So that's why I always think good portfolio construction is very important, and good self-discipline. I think also trying to be aware of where the innovation cycle is in terms of share prices and valuations. So in the from a complete startup to the first trial is normally the period of greatest hype and greatest excitement, and then it's followed by some sort of denouement, even for the ones that go on and be very, very successful. And so I think sometimes it's being a patient investor and waiting for that entry point. So understanding what you're buying, I'm probably further down the caution, because I come from the listed market. So I always want to see something tangible, which is I want to see that there is a product, and I want to see that there is a business plan for distributing that product. Maybe there's an end plan in finding a buyer, But so for me, I'm always looking for innovative companies that have disappointed but are still growing sales. Because for me, those are actually a few years into the cycle, rather than buying the latest hype story, which is, three people in a room with a great story and a great PR team, but they actually haven't done anything yet, and a bit of nice fancy science. I sort of like to see stuff. I like to see revenue, so I'm a bit old-fashioned in that way.
Yeah, and we are aware of a number of investors who run screens of market cap to number of RNS announcements and things like that, just exactly as a flag for those kind of things. It can be quite an intangible sort of sector to understand value, particularly when you're talking about the prize at the end is so significant. Is it gut feel, or are they? How do you go about actually assessing your risk and reward?
Well, we had 3 portfolios that we identified in the Cracking the Code book came out in 2012, and Anthony ran a sort of screen on them. And there was a conservative, medium, sort of conservative and highly speculative portfolio, and the best one was the conservative one, which did 2.5 times better than the S&P benchmark. And that's because it was diversified. And because some of the stocks that you think are conservative might actually, in the way that you're talking about, be undervalued and be revived or taken over or whatever. It's very hard to say exactly what factors are going to make people like Andrew and myself invest in a company, because there are so many of them.
Yeah.
But the number one is management, its track record, the quality of the science, the funding. Is this company running on fumes? Has it been running on fumes for years, which indicates that it's not got the institutional backing of note that it needs? What is the patent profile of its science like? Because if they're just about to run out of patent, then there's no, even if it's the best drug in the world, there's no point in investing in it, because the first $1 billion to make the first pill is quickly followed by 1 cent a pill thereafter when it goes generic. And the generic market is an interesting market, but it's not one which we're going to make a great deal of money. So there's so many factors, it's very hard to pin anyone down. But the research that you produce, as an example, is really good, and I read it on a daily basis. But I would say that the UK, this is the last thing I'm going to say on this subject, the UK, it costs a lot less to run a biotech company ab initio than it does in the United States. Somehow or other in the United States, they run through about 10 times more money per compound than we do in the UK. And I like that in the UK. I think that gives us a greater bang for our buck. And the science here is as good as the science in the United States. And after Boston and San Francisco, Oxford, Cambridge and London rank right up there. Would you agree with that?
Yeah, I do. I think they compete pari passu. I think our problem here is not innovation, not invention, not great science. It's impatience. I think the one thing that we don't do well is hold on to our innovation for long enough. I think sometimes we haven't been good at the venture end of actually recognizing the strength and power of those emerging franchises. And it does frustrate me a little bit that we often see people selling out for 10, 100 million even, to Americans who then go on to build $10 billion businesses with our invention and technology. So, I hope all the people who do venture investing and EIS and things like that, I think it's very important that we find a model that we can all lengthen our time horizon. In terms of when it comes to actually how you go about it, I think the hardest thing for any of us, whether we're amateurs or professionals, is removing the emotion from it. And I think when you get into technology and healthcare, it's very easy to get terribly excited. Jim and I can get you very excited about lots of things. Hopefully we've got you interested and excited about a few things. But you still have to get down to the brass tacks of what the business is about and what you understand. And when I sort of talk to people about how you sort of build portfolios, it comes back to what Jim used as diversification. And I always say that if you have utter conviction that you know nearly everything you need to know about a business, you can go all in, one shot, the entrepreneur's route. But remember that Henry Ford went bust twice before he made it. That most entrepreneurs get knocked down and have to pick themselves up again. So as a portfolio approach, not many of you will actually know enough about the science or the people or the opportunities to take that. So I do say keep pretty diversified, because there will be those errors. And I think diversification is one of the unsung heroes of good investing. I don't mean over-diversify. Don't mean go out and buy something from Vanguard, perish thought, I don't want to promote anything horrid like that. But actually, don't try to put all your bets in one theme, one technology, one vision of the world. There's no one way of doing it. So if in doubt, try and take a portfolio approach to it.
You touched on sort of keeping that sort of cool head. It's a sector, I think, partly because it's so much government spend is tied up in it. It's driven, it's capital hungry. So actually, it's quite susceptible to sentiment. There are periods, bust periods, are pretty awful. Seeing the number of companies that go out of business because they're sort of squeezed from a sort of funding perspective. How do you ride out the do you time, or do you take the long view? I think you kind of touched on that.
Yeah, I think it's something that we try to take. You're quite right. When you're in public equities, you can sit there every day if you have a Bloomberg or a Reuters or whatever. You can get mesmerised. You watch these things bouncing around constantly. And it's probably the Bloomberg screen is probably one of the worst inventions for long-term fundamental investors, because it makes you twitch. It's like taking Shire's Adderall, or having a quadruple espresso. So it's a balance, because if something's going horribly wrong, you don't want to ride it all the way down to zero if you can see it's going wrong. But we try to avoid taking a quarterly view on companies, even sometimes an annual view. Because some of the things we're talking about, if you're actually going from phase 1 to phase 2 to phase 3 to commercialization, we're talking probably anything up to 15 years. Or it used to be, it's shortened a bit. But these are long-term capital commitment cycles. So when I'm trying to assess a company, I try to think about the capital investment cycle of the business and try to think, can I align my investment horizon with that? Now, some projects like nuclear energy, it's a 70-year payback, and that's just way too long. I'll be good. I might still be around. Hopefully, Charlie will be looking after me. But for most businesses, I think we do try to take too shorter-term time horizon, and we do react to news headlines, to quarterly announcements, and all of which are just noise on the line. And I think the challenge for all of us as investors is working out what's the signal and what's the actual noise. And I think behavior of management is often one of the most important signals, as that trumps, because they are ultimate insiders. So when their behavior begins to deviate from successful patterns in the past, that maybe is a big red flag. So and I think lots of my friends who are private investors, I think they do often better than professional investors, because they're not scrutinized other than by themselves on a day-to-day basis, month to month. And the patient ones who invest for the long term and maybe only look at their portfolio every 6 months actually find that they've done rather well compounding up over the long term. And so I'm all for taking a long-term time horizon and not getting fixated about mistaking information for insight. And don't listen to me on Bloomberg or CNBC, for goodness sake, because they always ask me to make predictions and I'm always wrong. I've got all last 3 political events totally wrong, so...
We'll just do the opposite then.
Yeah, exactly, you can do the opposite.
And do you have a view on timing?
Well, all I can say is that my portfolio is littered with impulse purchases of a whole variety of stuff, and I always say that my long-term investments tend to be short-term ones that went wrong, and I've got plenty of them.
Yeah.
That having been said, you would expect in the industries in which I position myself, mining and biotech, to have a lot of disappointments. But the whole point about trying to acquire superior knowledge by knowing more people, getting a network effect, reading more, really studying, and I can tell you for the last year I've been really studying this subject of Juvenescence, is that you can narrow down the chances from those of a regular investor, from let's say 1 in 10 to maybe 1 in 3, and that really improves your chances, because when one goes right, it gushes like a money fountain, which is what we're aiming for, right? So.
I'll ask one more question and then I'll try and open the Q&A up to the floor, because I'm sure there's other things that they want to ask. But sort of stepping back up, we've gone through that journey of drivers of healthcare and areas of interest and risk and reward, etc. And we touched on the idea of the long view, and people who are best positioned in many ways to sort of direct long view is public bodies and the government. From an innovation perspective, are there things that you would like to see, the UK doing, the UN doing? What would you get excited about if you saw public announcements around?
To be fair to the government over the last 10 years, I think they've been highly supportive of innovation. I'm working on the CFA on social impact, so the government's beginning to try to find ways of encouraging investment into social enterprises that get a financial return but also bring a social or environmental benefit. I think that the government agencies on technology and innovation have been very supportive. I think what we do need to think more about are the vehicles that we use. My industry in the public market, everything has to be liquid. So you think about where we all save in our pension box. So pensions have gone away from the old defined benefit, is now largely DC. And so younger people who are saving now for retirement in 100 years' time actually have the ability to take the longest time horizon, have the biggest duration risk, if you like, and to invest in more illiquid infrastructure, private markets, things like that. But DC plans have to have daily liquidity, so therefore they have to invest in big boring things that we trade in every day. And so you end up actually having a regulatory environment that discourages investment in innovation for the very people who can not have all their money in it, but can accumulate money over the very long term in something that could bring real value to them and real value to society. So I think sometimes we get some of the simple things wrong. So for example, in France, they have medium-term investment vehicles called Fonds Solidaires, which you can put 90% into mainstream equities or bonds and 10% into social investments. They're a 5-year life. And those social investments are designed to make you a financial return as well as doing social good. We're trying to think about how you do that in Britain, but our DC model, our UCITS funds, don't allow you to do that. So I think sometimes it can be about encouraging and widening the scope for medium to long-term vehicles that allow people to get access to these markets in a diversified and sensible way.
So you asked about what the government can do. Well, I agree with Andrew that I think the government provides some pretty good incentives for innovation and actual financial backing. But two things it could do, which would be very helpful, is number one, to stop the idea of quantitative easing, which has distorted asset prices so badly that first of all it's extremely expensive to buy good quality stocks, and secondly we live in a zero return world, so it's even if people saved forever it may be very hard for them to generate a return. And the second thing is to stop lying about the fact that you may be able to retire if you're 20 years old today at the age of 67 or 68, as they gradually boil frogs in water and raise the retirement age. Because the fact of the matter is that no government will be able to afford the state pensions, or indeed possibly the healthcare costs of a very aging population. And we have to think that people will be working until they're 85 plus at some time in the relatively near future. And that means that companies have to embrace and value and treasure older workers. Notionally, their productivity may be less, but their empathetic skills, their wisdom is considerably greater than probably from younger people. So older workers will not just be hired, they will actually be required, because I agree with you. I think there's going to be plenty of jobs created in this world of automation. But there'll be different types of jobs. There'll be the social type of care jobs I was talking about earlier. There'll be jobs in hospitality and leisure, cruise liners or things like that, because older people want to go on cruises. They want to spend their leisure time in a different way to younger people. And then, of course, there's going to be jobs in healthcare, which will be a rapidly growing industry for the foreseeable future. So old people, not just hired, but required in the new societal construct that's coming. And I think everyone has to, and the other industry I want to mention that is going to be destroyed by this is the insurance industry. The life insurance industry is dead, all right? And people who work off actuarial tables based on Gompert's mortality curves, dating back to 1948, are going to be out of a job soon. First of all, automation is going to destroy the insurance industry, and secondly, the fact that people are going to live a lot longer than the mortality curves suggest means that it's a dead industry. So you can short that one.
Pick.
Right.
I'll pick up on the little rant against QE because I 100% agree with it. But what strikes me is that we could be in for quite an interesting period when it comes to actually how central banks actually cope with the world that we're in. And like Jim, I'm actually an optimist about what's going to happen in the next 50 years. I'm not one of those that succumb to the pessimism. And I think we could have a creative productivity environment where the norm is falling prices. And we have been brought up since the Second World War to believe that inflation is a really, really good thing, which is actually just a form of fraud by governments, if you actually think about it. If you go back to the 19th century, which was a pretty volatile period, admittedly, but you had a massive period of productivity. You think of the early 1800s, in London, mortality rate was around about 25, 27, because we had no sanitation, no running water, no healthcare, no education. Life expectancy had halved over the previous 400 or 500 years because of the Industrial Revolution. But once the Industrial Revolution began to settle down, so we began to have a massive rise in living standards. The bathroom was probably one of the biggest changes in life expectancy in the 19th century, but then we had telephones, railroads, all those great innovations. But falling prices was the norm. Another one, we had wars, so hopefully we're going to carry on avoiding wars. And actually, if you think about it, if you go through a period of high productivity, the unit cost of anything produced should fall, because you can produce them more cheaply, more of them, and sell them and still make a better profit. So if technology works in the way that we're optimistically expecting, then actually over the next 50 years we could have no inflation whatsoever, and that's not a bad thing, Mr. Carney or Mr. Draghi. It could actually turn out to be a very good thing if it's led by productivity. So trying to force inflation into the system, which will only actually make the value of your investments lower, seems to me a mistake and a basic error of economics.
Thank you.